So good morning everyone to this edition of Jaipur surgical tutorial for Sahil and some others who have probably joined for the first time. This is an online surgical education portal that we started at the Mahatma Gandhi Medical College and Hospital more than 3 years ago. It is being managed by my colleague Dr. Anand Nagar, who is an associate professor of HPV surgery and liver transplant at my. So we usually have case presentations. Sometimes we have operative surgery sessions, and from time to time we have lectures by guest faculty, both in surgery and allied specialities. But today we will have a very special session where one of my young colleagues, Dr. Sahil Gupta, who has done all his medical education and surgical training in India, but is currently a clinical fellow in the liver transplant program at the prestigious King's College Hospital in London. And it's I'm very grateful to him that he offered to have this presentation where he can tell and guide the students in surgery and GI and HPV surgery as to what are the opportunities for training in the UK for those who have been trained in India and how to go about it. I'm sure it's going to be a very useful presentation for all my young colleagues and students. And I would request Sahil to leave some time for questions and answers, because I'm sure there will be a lot of questions which people will ask. Anand, you would like to say something, or Dr. Naimish would like to add something before Sahil starts?
No, it's absolutely fine. Sahil can start.
Thank you, Dr. Naimish. So, good morning, everyone. As Professor Kapoor already mentioned, I'm a senior clinical fellow in liver transplant in King's College Hospital. I don't have too many slides so that I have room for discussion with the surgical trainees. So my topic will be opportunities in the United Kingdom for surgical training. So when I talk about opportunities, there are two types of opportunities. One is the research opportunities. There are some colleagues who are interested in doing a PhD or a research fellowship. And the second part are the clinical opportunities, which are the fellowships and the surgical residencies. So mostly I will be talking about the surgical clinical opportunities, which are the fellowships and the surgical residencies. So surgical specialties in UK are generally general surgery, vascular, pediatric surgery, plastic, urology, neurosurgery, cardiothoracics, and ophthalm. So colorectal, upper GI, hepatobiliary, liver transplant, and breast and endocrine comes under a subspecialty of general surgery. So we have to go through general surgery if we want to go through in these specialties. So surgical training program can be divided into two parts. One is the fellowship program. One is the residency, which we call in India is the training program. And in training program, one is CCT, which is an 8-year surgical residency for UK citizens or people who want to do their residency in UK. And other is CSER, which is Certificate of Eligibility, which shows equivalency. After doing your MS and MCH, if you have enough experience, you can show your equivalence, and I'll let you know how to do that without doing a complete training in UK. So from fellowship point of view, one can be a junior clinical fellow. A junior clinical fellow is a person who has done his MBBS in India and comes to UK for further studies. As a junior clinical fellow, you can join any department and then think about the opportunities you want to go about it. Senior clinical fellow post comes after minimum requirement is MS general surgery or a DNB general surgery. MCH, if you have, that is considered better. What is mandatory for getting a fellowship is a GMC registration. Like in India, we have state medical registration. In UK, we have a GMC registration, which is a mandatory. And we need an English proficiency test. So English proficiency test is mandatory. Even if you are from a native English-speaking country, that test is mandatory. These are two types of tests. I'll come to that in a brief moment. So first, GMC registration. How to get a GMC registration? So the pathways are either we can use MRCS. MRCS is two parts, step 1 and step 2. Step 1 is theory and step 2 is OSCE. it is held both in India and overseas. You can do both the parts in India as well. There are 4 royal colleges, and any college can be chosen. It does not make a difference. Still, if you want to choose the second college, whichever college you give step 2 for will be your permanent college. But at the end of the day, it does not make a difference. The other pathway to get is PLAB. If PLAB 1 and PLAB 2 has to be given. And the third pathway is through USMLE. Recently, GMC has changed its guidelines. If somebody has given USMLE steps before step 2 CS was scrapped, which was in 2000, early 2020, that they can directly register into GMC registration. So I would recommend going through MRCS. This is the most easiest path, and it's available in India, I know, easily. So you can get it done easily. So this is the registration site which can be used after we have done MRCS. Coming to the English proficiency test. English proficiency test is of 2 types. Well, one is OET, which is called Occupational English Test, which is valid for 2 years, and other is IELTS. So I would personally recommend doing OET, which is Occupational English Test. It comprises of 4 parts, which is listening, writing, speaking, and reading. OET is much easier as compared to IELTS, and if somebody has to choose one, I think OET would be a better option because it is profession dependent, and most of the questions are dependent on your own profession. So talking becomes very easy. There are free videos on the YouTube for the OET strategies. You don't need to have extra classes for that. So is it a mandatory to get do MRCS to get a GMC registration? No, it absolutely not. A sponsorship can be obtained from Royal College of Surgeons depending on your agreement with the trust. Especially for a medical training initiative, there is an initiative called MTI, in which Commonwealth and the people from developing countries can come to UK for a limited period, like 2 years, and get their training and go back to their own country. But English proficiency test, which is OET or IELTS, is still mandatory. So MTI fellowship, as I told, it is a Tier 5 visa, and after 2 years, there's a condition to return to your home country. So if you come to residency schemes are CCT, which is an 8-year surgical training program. It can be either started at ST1, which is first year, or if we have completed a surgical training in India, we can start at ST3 level. The other way of getting a residency equivalent is CSER, in which we have to show our degree equivalency based on number of procedures we have done, work-based assessments, procedure-based assessments, and a logbook. So it needs a bit of performa. I've mentioned the link downstairs. So with this, we can find out what is exactly required for a CSER for getting a degree equivalence to getting not doing a surgical training in UK. The other important thing is the logbook for surgical trainees. So this is a logbook used by Royal College of Surgeons in UK. All the procedures are logged on this logbook. Surgical trainees who want to think about UK training can use this logbook even when they are in India. It's a free platform, can be used by anyone, and our professors and consultants can be added on this logbook for verifying your training. So I've mentioned the link below as well, so that it's easier for people who want to come to UK to have the logbook beforehand. So when we apply for fellowship jobs, so there are 2 kind of scenarios. One is a person who has done his residency or MCH and wants to do just a fellowship. So they can apply through this website. This is NHS UK website, in which, depending on your specialty, you can put a filter if you want a breast, hepatobiliary, liver transplant or whichever specialty you want, you can put notification, and whichever vacancy comes, you will get a notification. Most of the fellowships will like you to have a GMC registration. If you have done MRCS, they will give time for you to do OET in between. But for surgical residency, there is a separate pathway, separate site altogether. This is mainly for fellowship programs. As I told, this is a surgical training in UK pathway. So neurosurgery, cardiothoracics training and everything, you can, after MRCS, you can join an ST3 level and do your training till ST8, which a lot of my colleagues have done that. But if you don't want to do this pathway, you can do FRCS and show your equivalency depending on your logbook numbers. You have to do enough number of papers, and there is a whole pro forma of like 40 pages, which we have to be fulfilled before you will find equivalent to this one. So mainly surgical training in UK is very sequential, and you can do a fellowship in depending on your choice of specialty in different institutes. And most of the things I think will be dependent on the questions which are asked. I have not made extensive slides so that it's easier for everyone to discuss whatever questions they have, or if they have any queries regarding the same.
Yeah. So before the students ask anything, I would request Dr. Naimish, because he has worked in the UK for a long time before coming to India, if he would like to add anything.
So thank you, Sahil, for a brief overview of the training in UK. A lot of things have changed since the time I've come back. Actually, it's more than 15, 16 years. I'm already back in India. So a lot of things have changed over the period, and I think it was always good for the current trainees to know what is happening, what are the opportunities available. So some of the things which I've heard from my colleagues who are already working as consultants in terms of training, Sahil, as you rightly pointed out, this MTI initiative, how helpful is it? And if anybody wants to convert from from MTI to a regular training, will that be possible? I think some of the residents or students would like to know that.
Definitely, Dr. Naimish. So conversion from MTI to a regular fellowship or a residency or a consultant post in UK is easy. It depends on your level of commitment and the trust you are in. If you show enough commitment, you can always change to surgical program or a consultant post.
Right, and you need.
So it's not mandatory that because you are on MTI, you have to come back.
So initially, when you come to UK, it is agreed like you have to go back, but depending on your commitment, depending on your will to do good things, and on your mentors here, it is definitely possible to stay longer and to become a consultant, even a consultant in UK.
No, it was the same thing what you were at, because my understanding was that you cannot convert from MTI to. It's a little difficult task to convert, because a lot of people who were going, though there was no MTI during my time, but now what I had heard and was under impression is that you cannot convert from MTI. You have to come back to India and then probably reapply. So that's what I thought I wanted to confirm with Sahil, so that many of the students would be very keen to know. Some of them, they do try to, if your intention is actually to stay in UK and continue your career or life in UK, then maybe MTI is not the ideal route to follow. Will that be a correct statement, Sahil?
I agree, Dr. Naimish. Very, very true.
So if somebody
MTI
wants to, sorry, go ahead.
MTI may be easier if your consultant here knows a consultant in the UK. Probably, although I am not, because at my time again MTI was not there, but I presume it must be on a mutual understanding basis. So
what I think, it is much simpler and easier to go into MTI. But if you intend to pursue a career in UK and you want to settle down in UK for your future prospects, then it is better to go through the proper surgical training, because then you will be absorbed faster into the system. From an MTI, then getting absorbed into the system, I'm not too convinced with that, because this MTI was specifically designed over the last decade for actually getting manpower or workforce from India. At the same time, those who are uh, going for the training, it will benefit that candidate and their back home hospital or home country as well. So the main intention of this was to get manpower or workforce. So when you go through an MTI, everybody in the institute, including the trust, looks at you as that you'll be going back in 2 years' time. So if you ask me, I think the conversion rate from MTI to a full-time training and then going into their career pathway, the conversion rate would be much lower. So if somebody seriously is thinking of going to UK and staying there, then it is better to go through a little further hardship of giving those either CLAB or MRCS and FRCS exam, and then going into that regular training pathway, which Sahil has already mentioned.
Sahil, what is the current status of the limited registration scheme? It used to be there earlier. Is it there?
So, Professor, at present, the special GMC has two types of registration. One is normal registration, which is after MBBS, and one is specialty register. Specialty register, which is with the if we do without CCT, without a surgical residency program in UK, is quite difficult and extensive. It might take 3 to 5 years to get that paperwork sorted. So it is quite extensive. So you have to think about it beforehand. Before, like Dr. Naimish rightly said, like if you come for MTI, better think it is the conversion rate is low. Although it's possible, its conversion rate is low. If you come on a fellowships, normal fellowship also, if you want to stay in this country as a consultant, getting absorbed through the surgical residency scheme would be better option, because getting chance into a specialty register is more. And if you still want to not do that and want to go through the Caesar pathway, which is showing the equivalency of Indian degrees to UK, it takes about 3 to 4 years sometimes with the paperwork and everything. But there is no limit to number of registration, but because it takes a lot of time, so at the end of the day they limit the registration through that.
So
I think what just regarding the registration, I thought I'll add is because there is something called a license to practice and limited registration, what Dr. Kapoor was trying to point out. I think you and I'm sure you are also renewing it, because what we are renewing as being out of the country, the UK registration, you can renew it, and that is called as limited registration. What is something else now you need to do is license to practice. That is a separate registration. So if you go to UK, one of your supervising consultant will have to certify or verify your training and then allow you to have a license to practice. So I and Dr. Kapoor both would be holding a limited registration. Today, if we want to go and practice in UK, we will need to apply for license to practice as well. So the limited registration means that your name is not taken off the medical register which is maintained. But if you still want to practice, then you have to apply something called a license to practice. So just wanted to add to what you said, Dr.
So one point which Sahil mentioned in one of his slides is this e-logbook. I would suggest to all students that if you have any idea or any inclination to go to the UK or even anywhere else like US, and even otherwise, I would suggest that it will be better that you maintain your logbook in this format, because this will be acceptable anywhere and everywhere rather than a manual logbook. It will carry more value. Second point I wanted to say that those who do not want to go and settle in UK but want to go there for some time to see the system there, to see to get some special training, there are other opportunities which are in the form of fellowships and scholarships. The most prestigious is the Commonwealth Fellowship, which usually is for those who are working in teaching institutions. I'm not sure whether somebody who's working in a corporate, although if you are running a DNB program, maybe you can justify yourself. But if you are in pure private non-teaching practice, probably you would not be eligible. So you should look up at that. There are two schemes: Commonwealth Scholarship, which is for those who are not in permanent employment, and Commonwealth Fellowship, those who are in teaching jobs. And initially, it used to be 1 year, but I think it has recently been reduced to 6 months or maybe even 3 months, which gives you an opportunity to go and work with somebody in the UK. The process is much easier because you are a Commonwealth Fellow, you get a quick, as I was mentioning, limited registration, which means that you are allowed to practice only in that hospital under that consultant or that department, not anywhere else. And that's one way of going to the UK for a short term and coming back. The other advantage of Commonwealth Fellowship is that if you are working in a government institution, because it's a government to government fellowship, the period for which you go to the UK, your institution is bound to give you full salary and full seniority, so you don't lose anything. That's the biggest advantage of the Commonwealth Fellowship. Second is, I don't know whether it is still there, but it used to be there till a few years ago, a P.N. Berry Educational Trust Scholarship, which in India was being managed earlier by Dr. Nandi. I'm sure he must be continuing to look after it now also. They invite applications for anywhere between 3 to 6 months. You have to arrange a host yourself, which I'm sure any of your senior consultants can help you. And then again, it works on the same principle. The Educational Trust in the UK, Dr. P.N. Berry probably was a practitioner there, and they help you to get the limited registration. And then there are UICC, International Union Against Cancer scholarships or fellowships, which are usually for 1 month. The funding is for 1 month, but you can stay up to 3 months, and you can apply, but that is specifically for training in oncology. So these are some opportunities. If any of the students wants to apply for these and get help from any one of us, you can contact me or Dr. Naimish. You can contact Sahil also for the local procedures. So I would request all the students who are there, if you have any questions, queries, please unmute yourself and ask.
Hello, sir. Hello.
Yes, please go ahead.
Good morning, sir. Sir, this is Dr. Yash Sinha, sir. I did my surgical gastroenterology from MGMCH, and following that, I did a brief fellowship in LDLT in New Delhi. I've cleared my MRCS examination, and I wanted to apply for a robotic, maybe a HPB or a liver transplant fellowship in the UK. So basically, I'm in the process of getting a GMC registration. But I heard that, to get those posts in the UK, you require a lot of recommendations. So, I mean, how do we arrange for that, or how do we find someone who would help us out for attaining those recommendations for getting into the UK, especially for such a program?
Yes. So the program you are mentioning is specifically for robotic HPB. So robotic HPB is mainly done in Royal Marsden's, and I agree it's a very, very competitive area because they have only 1 or 2
Yes.
posts per
Yeah.
year, and they don't generally prefer taking trainees out of UK. If you are in UK, you have a UK contact, they might be able to help you out with that. But Royal Marsden's have because a lot of trainees from UK apply for that specialty trainee, so it is quite difficult. But I can try helping you out, but the chances of getting it staying in India is quite slim. But if you are once in UK, then it's easier to get that fellowship, or 1 year. They have a 1 year and 2 year this fellowship program. But they don't do robotic liver transplant in UK. So mostly liver transplant programs in UK is disease donor liver transplant.
Yes, I get that. So one more query I had, sir. Suppose we go for get a senior clinical fellow in the UK, and we want to we'll be there in the UK for at least 1 year to for up to 2 years. So could we get a FRCS along, or what's the procedure to get our FRCS along with a senior clinical fellow there?
Yes, there is enough time to get FRCS done. So FRCS is again a two-step process, and once you are in a surgical training like senior clinical fellow here in UK, your post like your the trust and the employer will help you get the FRCS and give recommendation for FRCS.
Sir, and sir, I was just going through the sites, various websites, how to apply. So the site you mentioned, I had gone through that site also. So the program you are in, the liver transplant at King's, sir. So I heard that you need to contact the directors and tell them beforehand that you are interested in it, in joining that program, and so on. Is that helpful, or we directly apply through that NHS portal that you mentioned in your PPT, sir?
So the final pathway is through that NHS portal. If you contact the directors or the program lead beforehand, you might get an edge on the during the interview, and they can see how you are performing. But everything has to go through that portal only. There is no other way to get fellowship as of now in UK.
Yes. And so I just went to the sites. So the date period was ends in May. So I mean, do you have like specific slot openings like with which open like at a particular time of the year, or sir, do you have multiple throughout the year, sir?
No, it comes throughout the year. The fellowships are not regulated like it will start in June or July. It's not like that. Depending on the requirement, once like somebody leaves, they post a vacancy. So you have to keep looking. The fellowship might start and like in September as well, in January as well. There is no set timing for a fellowship program, especially for liver transplant to start in UK.
Okay, sir. Thank you so much, sir, uh, for answering our question, sir.
Most welcome. Most welcome.
Yes, and other students, I would say, look eastward also. Singapore, Japan, and Korea. I would say out of these three, Korea probably is the best because their volumes are good. The language is not a problem. In Japan, language is a problem. And the formalities and paperwork is probably less. They are more receptive. So some of your senior colleagues, including Dr. Supriya, they have been to Korea. And you should keep that option also in mind. Sahil,
Yes,
there is a question in the chat. Maybe you can take it. So it says that apart from the liver transplant fellowship program, are there other specific fellowship programs? And also, does it include pancreas? And he also wants to know whether India versus UK, what are the plus and minus points?
So that's very interesting question. So from transplant perspective, so the liver transplant, it's different in US and UK. US has solid organ transplant programs, which includes liver, kidney, pancreas mostly. But in UK, there are liver transplant programs like in King's, we do liver as well as multivisceral bowel. But there are specific pancreas and kidney transplant program. We do not do pancreas. Pancreas transplant programs are mostly in Oxford, Guy's and St. Thomas, then Edinburgh, which is Cambridge. So there are separate programs for liver and separate program for kidney and pancreas. Also in Birmingham, adult and pediatric liver transplant programs are separate. In King's, adult and pediatric liver transplant program are at the same state.
And India versus UK?
India versus UK. So India is dominantly a living donor liver transplant program. UK as of now is a disease donor transplant program. We do a lot of DBDs and DCDs, which is donation after circulatory arrest, which is not yet there rampant in India. And there's a lot of machine learning like organox and normothermic machine perfusions and NRPs. Living donor is limited in UK. So there's good and bad in both things. If you want to go back to India, it's better to have a training in living donor beforehand, or you have to get trained again. But if you want to settle in UK, then disease donor liver transplant program definitely is the way to go. But other one thing is the retrieval program, which you will learn, that will help you out in HPB and in living donor liver transplant programs as well, which is quite very good in UK.
Yeah, actually, that's what I was going to ask on behalf of the students, that suppose I'm a young surgeon, I want to get some training in transplant, but ultimately I have to come back, or I want to come back to India. So getting this training in the UK, which you said is mainly deceased donor, how helpful is it? Or should I try to go to a country like Korea, where majority of the transplants probably are still living donor?
So definitely, Professor Kapoor, Korea and Japan are very good living donor liver transplant program. So it depends on what the priorities are. Getting experience in disease donor definitely helps in surgical training. And even if you want to start recently, there have been increased organ donations, increased disease donor transplant programs in India as well. And even Hope and other machines are also coming. So I'm not very sure which pathway to choose, definitely. But in India, you have to have living donor transplant program in your mind. Even if you do get trained in disease donor, you have to have a background, or you have to have keep in mind you need time for living donor transplant program as well.
So if a trainee, yes, Dr. Naimish.
Sorry, can I add to that? Because during my tenure as well, a lot of people had this question coming up, and when we came back, there were only 2 centers doing transplant. So now there are 130 centers which are certified doing transplant, and I think every month we'll be having one more center which is being added. So in case the intention is to come back to India, then it might be worthwhile spending your time and gaining experience in any living donor liver transplant center in this country which are doing a decent volume, for 2 reasons. One, you will get an experience in LDLT, and two, wherever you go in the surgical fraternity, there is always a hierarchy, there is a system. So to get into the system, even if you come back from UK, how much ever experience you may be couple of years down the line, it will all be in DDLT, and hence you will have to start at the bottom of the line in wherever program you're joining. So in case your intention or the student's intention is to continue in India, then going to UK just for those 2 years to get a DDLT experience may not be worthwhile. It might be better to spend those 2 years in a living donor program in our own country. That will help you in every way.
And Sahil, if a young trainee joins a liver transplant program in the UK, how much is the non-transplant work?
Mostly, if you join a liver transplant program, all the work will be transplant related, either surgical or non-surgical. You will not be posted into general surgery or a breast or other units. You will be specific for a liver transplant system, but definitely you will be posted in hepatology to learn something about hepatology, and then critical care as well for a bit. But it will be always around the liver transplant scenario.
Couple of things in this, because a lot of people have a misconception about transplant training in UK and in US, as Sahil was trying to point out. In US, it is abdominal organ transplant, and in UK, there are only 6 major units doing transplant, which is it is always clubbed with HPB surgery. So most of these units are HPB and liver transplant. So you do get some experience in HPB work as well. It's not only purely transplant. There are some of the centers. So I'll just name a few, and Sahil can correct me if I'm wrong or things have changed. But one is in London, there are 2 centers. One is Royal Free and one is King's. In Birmingham, that's a major center. Then you have a center in Leeds, one center in Edinburgh, and one more center which I miss out. Sahil, there's one more center.
So we have Newcastle.
Newcastle, yes.
Edinburgh. No.
Yeah, correct. So and apart from that, sorry. So and Ireland, Dublin has got one more center, but again that's a different point. So these are only 6 centers which do transplant. So liver is generally distributed among this. The transplant is distributed among these 6 major centers, and most of these they do HPB work as well.
So, Sahil, at King's, how much of your work is transplant and how much is non-transplant HPB?
So, Professor Kapoor, in Kings, we have separate HPB and liver transplant program. So, I'm right now only in liver transplant. We don't go in HPB. So, in Kings, liver transplant and HPB are separate entities. In Royal Free, HPB and liver transplant, and in Newcastle, HPB and liver transplant are combined. Birmingham is have separated their liver transplant and HPB program. So, as Dr. Naimish rightly said, most of the center had liver transplant and HPV together, but now slowly a lot of centers are separating liver transplant as compared to HPV. In Kings, from last couple of years, HPV and transplant are two separate entities.
So if I join as a young trainee and suppose I start from year 1, you said it is a 6 years training. All 6 years I will be in transplant?
No, Professor Kapoor. So if it's a 6-year program, it will be a general surgical residency. You will be the person will be posted in each and every unit, and depending on the student's interest and the deanery, they can think of joining. So every 6 months, the trainee rotate to colorectal, to HPB or transplant. So this what I'm talking about, specific transplant. This is a fellowship program. You will stay in. If you are a fellow in transplant, you will stay in transplant. But if you are a surgical trainee in UK, then every 6 months your hospital as well as your trust changes, and there are basic general surgical domains you have to do, like endocrine, colorectal, breast, vascular. Other than that, there are upper GI, HPB, transplant, vascular access, and kidney transplant. Kidney pancreas can be decided depending on candidates' preference and interest and deaneries' availability.
But if I am going to the UK after finishing my MCH, or say if I have few years after MS and I join, as you said, ST3, then I would be only posted in transplant.
No, if you start ST3, which is a surgical residency program, you will be posted like everybody else.
Okay.
Just to add in, sorry sir, in the surgical training, the last 2 years usually are allowed. You can choose the specialty which you want to pursue, and you can spend your last 2 years in that specialty. Otherwise, as Sahil has already pointed out, you need to rotate through all the other specialties, including general surgery, vascular, breast, all these specialties you need to rotate. And then at the end of the your career, 5th year and 6th year, you can select which is your subspecialty you want to go for, and then spend 2 years in that.
What about simultaneous other qualifications like MSc, PhD, and all?
So most of the students who are doing surgical training, like from ST3, ST8, they do PhD in separate departments. It helps in getting a consultant post, because if you have a PhD along with a surgical training, it increases the chances of getting a consultant post in UK.
But you can do that parallel, simultaneously?
Yes, you can do that. Even if you want a 1 year off or off in between as well, the deanery provides you that pathway as well. Give you extra time to do the PhD as well.
Can you give a rough idea to the students about the approximate emoluments, cost of living, whether with the as a resident you can afford to take your family along and live a reasonable quality of life?
Definitely. So if I talk about London, so we get paid almost 4 to 5 K per month, 4 to 5,000 pounds per month after tax, and rent comes around 1,200 to 1,500, and groceries and everything comes about 800 to 1,000 pounds. So a lot of my colleagues have their family, and you are able to afford housing and everything with your family in UK if you are in a fellowship program. And if you go out of London, the things become cheaper. If you go towards Cambridge or you go towards this north of the country, things become cheaper. You might, because the house rents become in decrease, and you might be able to save some extra money. But the pay also decreases a bit if you, because London trainees get
Yes.
paid extra. But if on the other pathway, if you go to Dublin, the pay is structure is more as compared to what is right now in UK.
As a trainee, are you allowed to do locums?
Yes, but it is it does not seem good. Like, you have to have proper offs. Like, if you want to do locum shifts, you have to do specifically on your off days, and you have to tell your parent institute. But yes, we can do locum shifts and earn extra money.
Because I'm told that locum gets paid even better than the regular.
Yes, that's because of a lot of strikes and everything. Locum pay have increased. People get paid better. But again, the same thing in UK. The more you earn, the more you get taxed. So at the end of the day, definitely you get paid more, but you get taxed more as well.
What are the opportunities for the employment of the spouse if he or she is a doctor and a non-medical person?
So, personally speaking, my colleagues have wives in radiology, ophthalmology, and surgical branches. They have got their jobs after coming to UK, and generally, whichever trust you join, your seniors and your consultants help you get the post as well, because they can give you recommendation. For non medical
But
fields,
only
I'm not.
after, sorry, only after they clear the exam, isn't it?
Yes, definitely.
Suppose for some reason the spouse is not able to clear the exam. Are there any research opportunities, any other opportunities for a medical spouse?
So research opportunities are there. Research, I could not mention in detail research opportunities. There are research projects going on in every institute, but if for that, just non-clinical research you can get posted to. But I've not seen any of my colleagues' spouse getting absorbed into that till now, so I'm not very sure of that pathway yet.
Okay. And non-medical spouses?
I'm
Can
not sure.
they apply for a job? Are they allowed to work? Because in US, the restrictions are quite severe.
So on a dependent visa, because the policy has changed recently under Sunak, Prime Minister Sunak's government. Earlier, dependents were allowed, but now I think they have changed the until unless you are on dependent visa, you will not be able to allow to work more than certain number of hours in UK. But I think they might change it in future. I'm not 100% sure what. I think 20 hours if
You are a British, a European, or an Asian.
if you are a British citizen, definitely you get extra benefit at a consultant post as well as a fellow post. If you are a British citizen, that helps you out. Earlier, before Brexit, the Spanish, Italy, and everybody's general surgical residency training was approved in UK. But now recently it has changed. They also have to give exams to show that. So earlier they were equivalent to British citizens, but now things scenarios have changed. For Asians, there are a lot of Asians doctors working, and we get a lot of help. But there are always, at the consultant level, there is a bit of bias towards the person who has done, not just because of ethnicity, is because of the training. If you had done surgical training in UK, then you get benefit as compared to if you're going through the equivalency pathway or the fellowship pathway.
Social life, any problems?
No, socially it's perfectly fine. You get enough people here, you get enough offs, you get the work-life balance is quite good. So our number of hours you will work is limited, and there is designated offs. Trust takes care of your mental well-being, and there are enough Indian as well as Asian communities to hang around. So social wise, London is quite open to every every ethnicity. In north
Any
of the country,
discrimination?
there might be a bit struggle.
Any discrimination?
Not no discrimination.
Can I ask a question, Sahil? So the visa which you apply, or would these guys have to apply, or is it the HSMP or a work permit visa? What visas do you apply and have to go to UK?
So for a fellowship, either it's a tier 2, which is a skilled worker visa, or if you are coming on an MTI fellowship, it will be exchange program visa.
Right. Okay.
So if there are no more questions from the students, anybody wants to ask anything? Yes, please go ahead.
Sir, just one last question, sir. Sir, you got into the King's program in London, sir. So I wanted to know, a lot of people must have applied. So what do you think was different from which helped you get? I mean, in
Yeah, Sahil, he wants to know
fellowship.
what in your CV made them
Yes, sir.
select you. There must be so many other applicants also.
Yeah. I think Professor Kapoor and Dr. Naimish can answer this question better, because they will judge a person on CV, how to judge a person on CV and what a good CV looks like. For me, what I would like to say is, it's just not the clinical parameters which has looked at. You have to show your commitment towards research and your patient improvement projects. So my training in HPB and liver transplant helped. I was always interested in patient optimization. Like my thesis and everything was in patient optimization, how to improve patient outcomes. That helps. Then your research papers, your research participation, that helps definitely. And they are generally, every trust is looking not just for surgeons; they are looking for a doctor as a whole. How you behave, how you will treat a patient, how will you not just treat, how will you behave with the patient, how will you respond to their concerns, and also your behavior with the colleagues. Everything is taken into account, and everything is judged I think in an interview. But I think Dr. Naimish and Professor Kapoor can shed more light on that.
So for you, was there a interview? Was it online, physical?
It was a physical interview. So King's College Hospital generally has an online interview, but mine was an offline interview. It was done in Chennai.
So just to add a few things just a few things to be added to what he has asked. The UK is no different than India, or rather vice versa, because we were probably governed or ruled by the Britishers for 200 plus years. So we have inherited the same qualities. Your supervising consultant, obviously, because there are a lot of things which Sahil pointed out, which the hospital or the trust or the consultant who is appointing you would not know about your behavior, how you have been throughout your surgical career or training, how you have behaved with your colleagues, with your patients. That they generally get it from the referral from your supervising consultant. So yes, your supervising consultant should be speaking good about you. That is one. They'll be able to get you the job. Two, apart from what Silas said, the basic requirement is there for everybody. You need to do good work. You need to show commitment. You need to have good paper and publications. In India, we probably do not give that much importance to publication, but in UK, they are very keen to see what you have published and where you have published. Both these are equally important. Case reports do not really matter, but if have you done any research, whether you have done any basic research or you have done clinical research, how much you are committed to the job which you are applying, and in case it is MTI, whether you are a candidate who is looking at this opportunity to gain an entry into UK, or you actually want to learn for 2 years, 3 years, and then go back to your country. So if that intention is put across very clearly, then they'll be able to help you or absorb you. Because if your intention is to just train for a couple of years and then go back to your own country, they're very happy to hire you, because in at a consultant job it's like a pyramid there. Then a consultant job which Sahil did point it very subtly that there is a good amount of differentiation based on the ethnicity. So absorbing consultants in HPB and transplant is getting lesser. There is more opportunity in the other specialities. So if you want to go for the other specialty apart from HPB transplant, it will be easier and faster to be absorbed. So from overall, they will be looking at whether you are keen to go back. And if you are keen to go back in HPB and transplant, they'll be happy to host you for 2 years. And then they'll say, thank you, bye. So that is how it works. And again, recommendations would like to re-insist that recommendation is equally important of how you have done your training and your supervising consultant.
So
Yeah,
these
that's it.
recommendations are better from our professors in the college because we won't have like communication with the UK professors. So when you're applying from India, so like our
Well,
professors from India would,
see,
if
somebody
they come in.
who has seen you during your 3 years of your training, be it during MS or be it during your MCH program, your consultant, departmental consultant would have seen and worked with you much more closely. So their recommendation will have lot of weightage. Now, your point is very correct that those consultants may not have a direct communication with the consultants abroad. So, see, your supervising consultant would be senior enough to have their colleagues who would be knowing somebody abroad. So it's always that way. How you can probably put in a word, your supervising consultant can speak to somebody else who is in India and would know somebody in UK, and they can put in a word for you.
What Dr. Naimish said, he rightly mentioned. So whenever you apply for a job in UK, they will ask for minimum 2 referees, one whom you have worked in last 24 months, and one who you have worked in last 5 years. And they will send them an mail and to ask about all these things which Dr. Naimish rightly mentioned. And those consultants or colleagues or professors have to give them a reply, and based on that reply, you will be judged in that interview. So you will have to have minimum 2 referees whenever you apply for a job in UK.
Okay, I think we are coming close to the time of the session. Thank you, Sahil. Thank you very much. Thank you, Dr. Naimish, for joining and for your inputs. Thank you, Yash, for asking all those questions.